A British charity is urgently appealing to the UK government to grant visas for critically ill children from Gaza, enabling them to receive life-saving medical treatment unavailable in the conflict-ravaged region. Project Pure Hope has identified 2 young patients in desperate need, a 3-year-old boy severely burned in an airstrike that claimed the lives of his parents, and a 1-year-old infant suffering from a correctable birth defect but trapped in dire conditions. Medical teams working inside Gaza describe the situation as catastrophic. Hospitals are overwhelmed by the sheer number of casualties, with children making up the majority of those requiring emergency care. The last functioning hospital in southern Gaza is stretched to its limits, lacking sufficient staff, supplies, and facilities to cope with the ongoing crisis. Dr. Victoria Rose, a British surgeon on the ground, paints a grim picture. The scale of injuries is unprecedented, and the medical infrastructure is collapsing under the pressure. She highlights the heartbreaking case of Hatem, a toddler with burns covering 35% of his body, including his eyelids, hands, and feet. His parents were killed in the same airstrike that injured him, leaving him an orphan cared for by his grandfather, who questions the injustice of such suffering inflicted on innocent children. Another child, Karam, is living in a tent under unsanitary conditions with Hirschsprung disease, a birth defect that could be treated with surgery if the necessary medical resources were available. His mother, Manal, shares the emotional toll of watching her son suffer without access to proper care. Despite the ongoing conflict and humanitarian crisis, the UK has accepted only 2 patients from Gaza for medical treatment in the past 20 months. Project Pure Hope is calling for immediate government action to issue visas and facilitate urgent medical evacuations. The charity stresses that these children are not political pawns. They are vulnerable individuals whose survival depends on timely intervention. This is a moment for compassion and decisive action. The international community, and the UK in particular, has the capacity to save lives by providing access to advanced medical care. The children of Gaza deserve the same chance at recovery and hope as any child anywhere in the world. We urge viewers to raise awareness, support humanitarian efforts, and press policymakers to prioritize the health and safety of Gaza's children. Every voice counts in demanding that these young lives are not forgotten amid the conflict. The time to act is now. These children need more than words. They need life-saving treatment and a chance to heal. Let us stand together in solidarity and ensure that help reaches those who need it most.